Hi guys, in this section we are discussing about meningitis. So you already know it's a type of infection, right? So there are variety of infections and you have to study about their spread and how we can manage it and all, right? So the infections such as respiratory tract infections, tuberculosis, influenza, infections of central nervous system, infections of gastrointestinal tract, then infections of genitourinary tract. So this all you have to study, right? Among this, now we are going to discuss about the infections of central nervous system. So these infections of the central nervous system can be caused by a variety of pathogens. Those pathogens can be bacteria, viruses, fungi, or parasites. So, these pathogens can lead to the CNS infections such as meningitis, meningoencephalitis, brain and meningeal abscess, and shunt infections. Okay. So, here we are discussing about meningitis, that is infective meningitis. Before going in detail of meningitis, let us see the anatomy of the brain in brief. So here is a figure, it's just for your understanding purpose. So in the name itself we can see the definition for the meningitis, right? Meningitis, itis means inflammation, meninges means the layer that covers the brain, right? So there are three layers for the meninges: pia mater, arachnoid matter, and dura mater. So in this figure you can see the innermost layer, which is marked in yellow color as pia mater. Okay. Now coming to the second and the middle layer, it is marked in orange color in this figure. So it is the arachnoid layer, and the space between the arachnoid matter and the pia mater is known as subarachnoid space. And you can see there is trabecular meshworks which is marked as lines in the subarachnoid space in this figure. So this trabecular meshwork helps in the flow of cerebrospinal fluid. So this helps to prevent the brain from getting shock and all. Okay. So between the subarachnoid space you can see cerebrospinal fluid. Now coming to the outermost layer, which is known as dura mater. It is thick and fibrous. Now let us see the definition for the meningitis. So here are the two layers, innermost pia mater and the middle layer arachnoid matter. These two layers together are known as leptomeninges. So the infection to the meninges is mainly the infection to the leptomeninges. Okay. So in the medical scenario, when the clinicians are suggesting the patient is having meningitis, it is nothing but the leptomeningitis. Okay. So the inflammation to the pia mater and the arachnoid matter, that is the leptomeninges, is the leptomeningitis. And also it includes the inflammation of CSF in the subarachnoid space. Okay. So I think now you can derive the definition. Meningitis is nothing but the inflammation of the leptomeninges, that is pia mater and the arachnoid matter, and also the inflammation of the CSF in the subarachnoid space. Okay. Now the infection can also affect sometimes to the outermost layer, that is dura mater. So it is not common, but still sometimes it can occur. So it is mostly due to the external stimuli such as trauma and all. So when the dura mater is affected with such infection or inflammation, that is referred as pachy meningitis. Now in this figure you can see the clear picture of the brain. So here you can see arachnoid matter, pia matter, and the dura mater, cerebrum, cerebellum, pons, medulla. Okay. Also you can see the ventricular system. So the ventricular system is nothing but the ventricles which are filled with CSF. So these are the lumens which are helping the communication between the cavities, right? So here you can see two lateral ventricles, fourth ventricle, third ventricle, and cerebral aqueduct. So these all ventricles are filled with choroid plexus. So the arteries of these choroid plexus produces CSF, and this CSF is then drained to the subarachnoid space through foramen. Okay. Now coming to the epidemiology. Approximately 1.2 million cases of acute bacterial meningitis occur every year around the globe, and it results in the deaths of 135,000 persons. Okay. So the overall mortality rate for patients with meningitis ranges from 2 to 30%. So the patient who develops meningitis, they shows the neurologic sequelae such as seizures, sensory neural hearing loss, and hydrocephalus. And the risk for development of this neurologic sequelae depends upon the type of the organism that infects that patient. Generally, 30 to 50% of the patients who survive meningitis may develop neurologic disabilities. So there are two important recent findings that have the potential for great epidemiologic impact on bacterial meningitis. First one is both positive and active exposures to cigarette smoking. So this is shown to be the risk factor for bacterial meningitis, especially for meningococcal meningitis. And the second one is the children with cochlear implants that include a positioner. So they are at increased risk of bacterial meningitis, specifically pneumococcal meningitis. Now coming to the routes of transmission. So we already discussed that the CNS infections can be due to viruses, bacteria, fungi, or parasites, right? So in case of meningitis, it can be due to bacteria, virus, and fungi. So let us see how these microbes are transmitted into the brain. So first route is direct implantation. So in direct implantation, let us see how these microbes are directly entering the brain. So it can be through a trauma, a hemorrhage, or bones broken in the skull, basilar fracture, or congenital malformation. So these all can lead to the implantation of the microbes directly into the central nervous system. Then coming to the next one, neighboring infections. So this one includes paranaso sinus infections, then otitis media, infected teeth, osteomyelitis of the skull bones, vertebra. These all type of infections can lead to the development of CNS infections. Now coming to the most important and more common path it is hematogenous spread. So it can be through the vascular system. The microbes are transferring into the central nervous system. So it can be through the arterial or the venous system. So example is pneumonia, bronchiectasis, bacterial endocarditis. In all of these diseases, the infectious agent spread reaches the vascular system and then finally reaches to the central nervous system, right? So that's all for today. Thank you.